shin pain due to lumbar disc bulges. If you're suffering from L4, L5 disc bulges, one of the common symptoms that you suffer is shin pain. Many of you guys requested to create some rehab plan for your recovery. In this video, I'm going to share with you what are the main symptoms that you can discover while you're suffering from L4, L5 disc bulges. Also, I'm going to share with you how do we examine this condition in the clinic. And at the end of this video, I'm going to share with you series of exercise and tips that can help you to maximize your recovery. The common symptoms of L4, L5 disc bulges are listed as below. You may have pain and irritation from the side of the glutes all the way down to the front of the thigh and the shin, and it can go all the way to your big toe. You may develop numbness and lack of strength around the similar area of your hip, your thighs, and all the way down to the shin. And in some cases, you may create some sort of weakness in your foot while you're walking. Pins and needle or tingling sensation around the same area of the hip, thighs, or shin, all the way down to the ankle. The last common symptoms is pain with prolonged sitting. For clinic examination of this condition, patient might develop myotome and dermatome deficit on the same area of the hip, front of the thigh, the shin, and the big toe. The second common test that we apply in the clinic for patients for L4, L5 disc bulges is reflex test. Patient with a positive L4, L5 disc bulges can develop positive reflex test on patella and Achilles tendon. The last common test that we apply in the clinic base is gait analysis. Patient need to walk on their toes and their heels and show complete coordination and strength while walking. Alright guys, the first move that I'm going to share with you guys in this video is going to be figure 4 stretch. This can hugely help you to open up your hip and give you some sort of relief on the side that you feel that pain on the hip, on the thighs and the shin. There are so many different variety of figure 4 that you can do. I'm going to show you a simplest one. The first version would be just crossing the leg that you have symptoms on, cross it on the other side. This movement can simply even help you to get that kind of comfort and feel that stretch and movement. You kind of want to mobilize it kind of like to the right and left. That gets more stretch into that area gently. Now, if you find this movement easy, you can bring the opposite foot up, hold it there for 5-10 seconds. Breathe in and out. Make sure that you're not overstretching it too much. Like, I really don't want it to really bring it too high because that can be sometimes aggravating your symptoms. You want to be on a gentle side of the stretch. Sometimes that would be more than enough. Now, you're going to hold this stretch for 10 to 15 seconds, 2 to 3 times through the day. The following movement that we're going to do, guys, we call it femoral nerve floss, which is you're going to be on kind of like face down position, and we're trying to, let's say, we presume the right side is the leg that is affected. There are 2 movements in this exercise. The first thing is that you're getting to this back extension. We're trying to move the neck down and bring the legs up, which means you flexing the knee, and then we bring it back up. Flex the knee and back up. This movement hugely helps you to floss the nerve. Now, if you find this is difficult to get that range or be in this position, you can try to just lift the legs up, yeah? And back down. Gently lift the legs and back down. Slow control up. This is like 2 inches off the ground and back down. Now, I find this movement a little bit more challenging for me. You have to try and see which one feels easier for you. Practice this for 3 sets of 8 to 10 repetitions daily. Find how you can do it more comfortable. Comfort is hugely important, guys. If you want to do it on both sides, it's totally fine. Give it a try and let me know how you're getting on. The following movement that I'm going to share with you guys is going to be cat-cow movement. Cat-cow help you mobilize your lower back, get you some flexion and extension on the lower back. You're going to be on quadruped position, knee underneath of the hip, hands underneath of the shoulder, and you're trying to get that flexion and extension in your lower back. Bring it up, back down. You want to breathe in and out while you're doing it. Try this exercise for 3 sets of 8 to 10 repetition, being in a comfortable range, and you will see as more you follow these exercises, you see more movement and mobility. That's hugely important. Be very consistent by doing them daily, at least 2 to 3 times. The following move that I'm going to share with you guys is going to be hip flexor stretch. It doesn't only stretch your hip flexor, it stretches your whole hip and sometimes your groin muscle. You want to be in kind of kneeling position. You're going to stretch both sides. Just make sure that you're cushioning this knee. It has to be comfortable. Bed would be a good place to start with. We're trying to simply just get the back in a neutral position and lean forward, which means you want to kind of like lean forward to the point that you feel the stretch on both sides. You want to avoid looking down, keep the back nice and tall. Breathe in and out. Slowly you can bring the toes out a little bit. Hold it there 10 to 15 seconds. When you find it feels good, you can try to stretch the other side. Now, it doesn't matter really which side is affected. This exercise can be done for both sides. It's a really good hip opener. Breathe in and out. If you want to get more range, you can open up the leg from each other and lean forward. It really helps to open up the groin, the hip flexor muscles. You want to hold it there for 10, 15, 20 seconds. Practice it 2 to 3 times for optimum result. The last move that I'm going to share with you guys in this routine is going to be hip opener, which is hip 90-90. You're going to be on a seated position here, somewhere soft and cushioned would be good. You want to use your hand and try to stabilize your back. And we're trying to rotate the hip in, get to that internal and external rotation on both sides. This is a very gentle but very effective movements. I'm going to show you on both sides, which means if I'm on a side this way, you can see where is my hands, how far I go back. Now, the more you go back with your hands, it gives you more range. The more you get closer to the body, you have basically more challenge to get that movement. Now, the more you do this exercise, you get more benefit and you start to really see that mobility improve around the hip area. Try it for 3 sets of 8 to 10 repetitions, 2 to 3 times through the day. I'm going to share with you 3 important tips that can help you while you're following these exercises maximize your recovery. The first tips that I would like to share with you guys is to avoid passive treatment. While you're suffering from L4-L5 disc bulges, try to minimize passive treatment and massage around your lumbar and your hip area because that can hugely aggravate your symptoms. The second tips that I would like to share with you guys is prolonged sitting. By having L4-L5 disc bulges, sitting can hugely aggravate your symptoms, and I would suggest all of my patients to give themselves a regular break, stand up, go for a short walk, and get back to desk. The last tips that I would like to share with you guys in this video is consistency. L4-L5 disc bulges takes time for recovery, and I would highly recommend you to stick to this plan for minimum 8 to 12 weeks. Thank you for watching this video. If you find this video helpful, make sure to subscribe my channel for my weekly update, and don't forget to press that like button. If you have any friends or family who get benefit from watching this video, make sure to share this video with them. Until next week, all the best.